Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Carbachol. Carbachol is direct plus indirect. Carbachol is nicotinic more commonly than muscarinic receptors. Carbachol acts mainly on nicotinic receptors more commonly than muscarinic receptors. Carbachol also releases the stored acetylcholine. It is lucitropic, that is, it has myocardial relaxant effect is present. It has maximum hypotension and also it causes maximum bradycardia is also seen. Then it do not give carbachol has an IV injection. Carbachol is most cardioselective, thus acting on M2 receptors. Beta methyl groups at methacidin and bithanacol decreases its potency.
thank you and thank you for watching.